After comparing Medicare Advantage plans for 18 years, we've noticed that they all have these three things in common. Yes, it's really that simple. In today's video, we're going to show you how you can use these three things to find the best Medicare Advantage plan year after year and never make the wrong decision.
Before we start though, do you know what the first step is? Step 1 is to understand the terminology.
Yes, and many have even said Medicare's terminology is like learning another language.
你好吗? Some of you may have heard of that greeting before, but may not understand completely the meaning.
Yes, honey, just like learning Chinese, a lot of people have said Medicare is even more difficult than learning Chinese.
But we won't make it so difficult.
So before we show you the three things to know in order to choose the best Medicare Advantage plan, let's learn the most basic terminologies, such as HMOs, HMO POS, PPOs, C-SNP, and D-SNP plans. We'll make this simple, so if you want further details, feel free to call us.
Here's the breakdown. HMOs.
Not HBO.
Not HBO. That's right. We've had clients call HMOs HBOs. HMO, or Health Maintenance Organization, means you can only go to the doctors on the network and typically need a referral to see a specialist.
You don't always need a referral, but for the most part you do, unless you have an HMO POS, which we'll discuss in a bit. And you can sometimes go out of network under special circumstances, especially if you need urgent or emergency care.
Then you have an HMO plan called Point of Service, or POS, which does not require you to get a referral to see a specialist. So in other words, you get to point yourself to the specialist without a referral. Even though you must stay within their network like a traditional HMO, there's more flexibility with an HMO POS plan.
Right, so think of it as your HBO Max plan.
Oh, good one, Kai. Now we're gonna get people calling us for an HBO Max plan.
Well, anyway, now let's move on to the PPO plans. PPO means there's a preferred provider organization. The word preferred means they will give you the lower copays if you go to their preferred provider list. Now, if you decide to go outside the network to a Medicare doctor that is not on the list, then you pay the higher copays or co-insurance listed in your summary of benefits.
And finally, there are special needs plans. The C-SNP stands for Chronic Special Needs Plan, and typically anything to do with the heart, lung, or diabetes-related needs. The D-SNP stands for Dual Special Needs Plan, and dual meaning you have both Medicare and Medicaid.
Well, now there's another terminology we need to explain.
Yes, Medicaid, or our state, it's called Medi-Cal, is a state healthcare program for those with low income and low assets. And to qualify for a D-SNP plan, you must have a full Medicaid status, meaning you have no share of cost or deductible with your state health plan. And to see if you qualify, look up the information online for your state or give us a call. There are a few other types like HMO, HSA, PFFS, MSA, and so forth, but those are not very common, so we won't cover them in today's video. Again, feel free to call us if you want more details. Okay, so let's now reveal the three things that all Medicare Advantage plans boil down to so that you can find the best plan for you.
But first, we would like to thank all of you in advance for helping our channel grow by clicking the like button, commenting, and subscribing. I know all that sounds silly, but this is what YouTube actually looks at in order to share this video with other people. And to show our gratitude, here's a picture of Gracie enjoying her matcha boba green tea.
Okay, first is new plans in your area.
Second is the established plans in
And
your area.
then third is one-stop shop.
Now, the first two columns could include all the HMO, HMO POS, HBO Max, just kidding, PPO, C-SNP, and D-SNP plans. Now, let's first discuss the new plans in your area column.
Now, when we say new plans, we're not only referring to companies that you have never heard of, but these also include so-called national companies like Aetna, United Healthcare, Humana, and so forth. Now, why would we have such big name companies in the new plans column? It's because these plans are typically a plan in your area that is either brand new or have been covering your area for only a few years.
Now, what are the pros and cons of this new plans column? To better understand, remember Medicare is giving all of these Medicare Advantage plans around $1,000 per month per member to manage your care. And along with following Medicare's guidelines, it's up to the Medicare Advantage plan on how they want to use the money. You could say just like building a car. You have so much money to use. Will you put the money towards the engine, the design, or maybe the warranty? Well, there are 3 areas the insurance companies typically use the money to build a plan. Now, no, we're not referring to how much they're going to pay the CEO of the insurance company, which I'm sure some of you want to comment on that. Rather, we're referring to their network of doctors, their coverage, like copays and deductibles, and auxiliary benefits like dental, vision, gym memberships, and so forth.
First, let's start with the pros for this new plans column. You typically will have the lowest copays and the lowest maximum out-of-pocket costs.
Yes, and we've seen it even as low as $500 in some areas.
Yes, it might seem too good to be true, but remember, the insurance company is using the money they receive from the government to cover most of your medical bills. Why would they do that? It's because they want as many people to sign up with their plan to receive their subsidy from the government. This mainly applies to smaller local Medicare Advantage plans since they don't have their name recognition yet.
We've even seen some companies not manage the money correctly and give so much money away that they eventually went bankrupt. However, larger companies might also entice you with low copay since they are still new to the area.
Another advantage is that these new plans might also have more auxiliary benefits like dental, vision, gym memberships, hearing aids, acupuncture, transportation, over-the-counter items, groceries, pet services, and so forth.
Yes, the key word is more. Not just more, but usually all of this at no extra monthly premium for these newer plans.
And the majority of Medicare Advantage plans will have some and if not all of these perks, which is why Medicare calls them the bundled plans.
Now remember the money they're getting from the government. Well, they're spending the money on the more obvious, if you will, to catch your attention, such as the benefits and perks. So are these the best plans, as some agents and maybe even some of your friends might say? Well, what are the disadvantages? Think of anything that's new. There's usually kinks to iron out. Well, in medical, the kinks to iron out might be customer service, billing, and most importantly, the network of hospitals and doctors.
Yes, the hospital and doctors on the network will most likely, but not always, be smaller than the other 2 columns. Even the doctors still getting to know these plans because they are so new in your area.
Yes, don't get fooled by the agents saying that these plans have been around for so many years in Medicare or the healthcare industry. The key is how long has that plan been in your county? Again, we're not saying that this is the case for every new plan in your area, but it's typically the case.
So, are you the type of person where your main concern is the lowest copays or maximum out-of-pocket? Also, are those extra perks we discussed earlier just as important to you as well?
Yes, to be clear, we're not against these new plans, and we do have clients on these types of plans. There have been times my mom chose these plans as well. Just ask yourself, are you okay with the smaller network? Your primary care doctor might be on the network, but are you okay with a smaller network of specialists and hospitals?
Yes, we have seen large, well-known companies go into a county where the benefits look awesome and our clients' primary doctor is even on the network. However, we only found one hospital that accepts the plan.
Yes, and this is why our clients a lot of times will choose the established plans.
So when comparing the established to the newer plan, the biggest difference is the established plan will typically give you a larger network of hospitals and doctors.
And the disadvantage are usually less perks. And in other words, the dental, for example, might be just preventative, whereas the newer plans might give you full dental plan. Again, this is just an example, but the key is they will still give you auxiliary benefits as part of your plans, just not as much as the new plans.
And the third column is the one-stop shop plans. And what we mean by a one-stop shop plan is that the primary care, labs, x-rays, and specialists are under one building. And that's the main appeal of these plans.
Yeah, sort of like you can say going to your shopping mall or your local Costco. Anne loves Costco.
Oh yeah, I do. Whereas the other 2 types of plans are typically contracted only with private doctors and not under just one building, which means you'll have to drive to different locations for doctor visits, labs, and so forth.
Now, not every county has these one-stop shop type of plans. Now, in California, for example, we have Kaiser, Sutter, Palo Alto Medical Foundation, John Muir, Stanford, and so forth. And if you live in a county that has a one-stop shop plan, then what are the disadvantages? Well, the disadvantages are similar to the established plans since they will use more of the money for the network or doctors and also the facilities, and less on the auxiliary benefits. In some cases, you must purchase a dental or vision plan separately.
These plans also will have higher copays in the newer or more experienced column. Also, in most cases, there's a premium for these type of plans. However, we have seen some counties where they offer zero premium, but that's rare.
So these are the best plans for you if you absolutely need and want a one-stop shop plan. The monthly premium that we've seen is typically around $30 to $90 per month. So ask yourself, do I mind a monthly premium? Do I care if the copays are typically higher than the other plans? Is my main concern a one-stop shop?
Again, this chart we created is to give you a general idea. However, we're confident that understanding these three things, along with the terminologies, will help you to choose the best Medicare Advantage for you. And let us know in the comments which plan you would choose.
The new plans, established plans, or the one-stop shop? But be careful. Do you know the consequences of starting with any of these Medicare Advantage plans and then going back to a Medigap Medicare Supplement plan? Do you know that there are 3 different Medicare Open Enrollments and the differences between the 3 open enrollments and how they may affect you?
Well, if you don't want to make the wrong decision, then watch this video here to learn of all 3 Medicare enrollment periods and how they affect you.